Hello, my name is Dr. Daniel Soffer. I'm a clinical associate professor of medicine at Perelman School of Medicine, University of Pennsylvania. I also serve as one of the course directors and faculty for the Plaque Club, the Philadelphia Lipid and Atherosclerosis Club. Welcome to CVI Heartbites. CVI Heartbites is a free, non-accredited educational program produced by the Cardiovascular Institute of Philadelphia, featuring succinct presentations delivered by leading experts on timely topics in cardiovascular medicine. This CVI Heartbites segment focuses on apheresis in the time of COVID-19. Please note this presentation was recorded on May 18, 2020, and the information was up to date as of that time. At the end of my presentation, you will see some additional resources and have the opportunity to contact me with any questions you may have. These are my contacts. Please feel free to reach out with any questions. The concept of doing a talk on apheresis in the time of COVID-19 was prompted by a tweet from a colleague of mine who sent out this message: I have an FH patient requiring LDL apheresis. Is it even possible in times of COVID-19? Do we know if equipment can be properly sterilized? This simple question set up a round of conversation amongst cardio Twitter and people interested in apheresis. For those of you who aren't familiar, apheresis is really a form of extracorporeal blood purification. And interestingly, this whole concept actually dates back to medieval times. You can see in this, this etching here of this relatively robust-looking man who obviously is the sick person who has the toxins being removed from his system and the good blood being put into his system. And in this case, the good blood looks like it's coming from some sort of creature, I guess a dog. It's hard to say for sure. I don't really know the origin of this. But in general terms, apheresis is simply stated by this stick figure here, where blood is drawn out. The components are able to be separated outside the body. Toxins or things you want removed from the body can be separated and removed, and the rest of the blood can be returned to the body. So that is the basics for apheresis. In preventive cardiology and clinical lipidology, we use lipoprotein apheresis. Specifically, the devices we use remove ApoB containing lipoproteins LDL, VLDL, and lipoprotein a. It has beneficial effects not just on lowering those lipoproteins, but also for reducing plasma components associated with inflammation, including C-reactive protein and fibrinogen, while sparing HDL, albumin, and immunoglobulins, amongst others. And there is evidence of reduced cardiovascular event rates with this therapy. These are just some examples of the tools. There's different types of lipoprotein apheresis available. At our institution, we use a Dextran sulfate filter. Dextran sulfate has a very strong negative charge, and you create this strong electrostatic attraction with positively charged ApoB, which is the main structural component for those lipoproteins that are mentioned. And so that strong electrostatic attraction enables those particles to be bound to the dextran sulfate, and they can thus be removed from the blood by sticking to the filter. In the United States, the FDA approves lipoprotein apheresis for 4 functional groups. Group A is a group of patients with homozygous familial hypercholesterolemia with LDL cholesterol levels well over 500 milligrams per deciliter. Group B are the heterozygote patients who will have LDL cholesterol levels over 300 milligrams per deciliter. And the other 2 groups have a lot in common. They are heterozygous patients with LDL cholesterol levels over 100 milligrams per deciliter on maximally tolerated pharmacotherapy who have documented coronary artery disease or peripheral arterial disease. And the 2 groups are different in that you can be eligible for apheresis if you have those criteria, but also if you have lipoprotein a greater than 60 milligrams per deciliter in the second group. And so there are 4 groups now that are approved for lipoprotein apheresis in the United States. So apheresis reduces the 2 main toxins that we're concerned about with atherosclerosis, both the LDL particles and inflammatory markers. You get a characteristic sawtooth reduction in the LDL cholesterol levels, with each treatment lowering the LDL cholesterol 50 to 75%, yet the average reduction is more in keeping with about a 40% reduction. C-reactive protein levels also go way down with each treatment and then come back up. And what you see with both LDL cholesterol and C-reactive protein is this reduction of the pre-treatment levels after a steady state has been reached, but recurrence, persistently elevated level of both with reductions with each treatment. The concept of whether or not apheresis should be used during the COVID-19 crisis came up in thinking about its potential uses in different ways. So imagine your patient who has ASCVD or who has extensive atherosclerosis, and they get exposed to and get sick from COVID-19. They may end up sick in the intensive care unit and critically ill or worse. Now, alternatively, if that person is exposed to and gets sick from COVID-19, is getting apheresis on a regular basis, and during that apheresis they have their cytokines being effectively removed by the procedure, is it possible that they'll be more likely to recover back to their pre-morbid state? Or are they going to go on and get just as sick as anyone else? Now, another use for apheresis might be, what if they're already sick in the intensive care unit in the middle of cytotoxin storm? Is there any benefit from apheresis in that context, where you're removing the cytokines with apheresis? And the real answer is it's unknown, and potentially there's some room for investigation there. The other use for apheresis in the time of COVID-19 is for convalescent serum and the separation of that important therapeutic antibodies from convalescent serum. So how might apheresis be helpful in the time of an infection? Well, if you think about the normal timeline for infection, there's the early viral replication phase, and as the virus stops replicating and as your body is starting to deal with the amount of virus that's present, your immune system is really kicking in, and you have this big explosion of cytokines leading to a cytokine storm, and eventually it's the consequences of that cytokine storm that leads to the worst part of the infection and the worst outcomes. So if you're getting apheresis early on, and your procedure occurs as the virus is replicating, it's not likely that apheresis will have any impact whatsoever. However, if you're a little bit later in the stage of the infection and you get your apheresis treatment, is it possible that getting that apheresis will reduce the cytokines early enough to turn off that early cytokine production and enable you to get over the viral replication phase safely, and that this may actually have some therapeutic benefit? Or finally, if you're hitting the infection late, towards the end of that 2-week phase, and you're already pretty sick, and you're doing apheresis in someone who's in the throes of the illness, perhaps just on the verge of a cytokine storm, perhaps early in the ICU, could there be any benefit there in terms of removing cytokines in the middle of this critical illness? So this concept has been looked at before for other types of infections. For sepsis, there is some experimental and clinical studies that have reported some promising results. And the larger studies, though, tend to be a little less promising. There's some neutral effects in certain studies. There's some beneficial or trends towards improvement in other studies. But important questions still remain for the clinical management, including the timing, the duration, the frequency of the therapies, and who's safe enough to get this, and are there any downsides to doing it? Obviously, some large multi-center trials are required, and the experts in the field really feel that it's not quite ready for prime time, but it's a reasonable consideration. There is an emergency use authorization for 2 different apheresis procedures, not the ones that we use at our institution or that are commercially available yet, but that were approved for use within EUA for patients with COVID-19 who are critically ill but not yet on a ventilator. And none of that has been reported yet in terms of results, and I don't know if it's actually in use in any institutions right this moment. But the use for apheresis that I think everyone has heard of is this use for convalescent serum, for convalescent plasma for COVID-19. There is a history of this for other infections, including going back more than 100 years with diphtheria, also with rabies and other viral syndromes. There's different FDA pathways to being to receiving this kind of approach. There's clinical trials ongoing. They've already published some data from China. Houston Methodist was the first in the United States to publish, and we have an ongoing trial at Penn hoping to get as many as 50 patients involved in that study. And so the FDA has allowed for study of this. The Houston group actually just recently published their data, and it's quite interesting. Of the patients that they reported, you can see by looking at their outcomes that so far it looks fairly promising in terms of mortality. Each of these horizontal bars represents a patient who received convalescent serum as part of their treatment. The box at the far right represents whether the patient is alive or is dead, and you can see all of the boxes are open boxes indicating that the patient has survived, except for one about 6 or 7 rows down. You can see that one patient is deceased. And so some early promising results from studies with convalescent plasma coming out of Houston. So I just want to conclude that it's pretty clear right now that lipoprotein apheresis is not a treatment for COVID-19. We don't have enough data supporting its use in that setting, but it was an intriguing question to look into, and I'm glad we had that opportunity. Please feel free to reach out if you have any questions regarding lipoprotein apheresis at our center or elsewhere, and if you have any questions about cholesterol management.